There is one last microbe that your book describes as part of the foodborne and waterborne illness section, and that is Clostridium difficile. Clostridium difficile is generally not acquired from contaminated food and water, however. It's more commonly found in patients in hospitals, and they typically acquire it from healthcare workers or because they have the microbe already in their intestines. The microbe that exists already in their intestines is allowed to grow and cause an infection if that patient has been on antibiotic treatment that has killed many of the other commensal and mutualistic microbes in their intestine, allowing Clostridium difficile to grow out of control. Clostridium difficile causes very foul-smelling diarrhea in these hospital patients and can be deadly, most often because these patients are already affected by other microbes or diseases, and that's why they're in the hospital to begin with. Clostridium difficile, as part of the Clostridium genus, can still form endospores, and this is why anyone who works with a patient with Clostridium difficile must wear gloves and a gown and wash their hands thoroughly, because hand sanitizer will not kill Clostridium difficile endospores. Also, because this microbe is generally acquired as a result of antibiotic treatment killing many of the natural microflora in the patient, additional antibiotics are not always helpful. Instead, the most commonly effective treatment today is fecal transplants. In this case, feces containing beneficial bacteria from healthy individuals are placed in the large intestine of individuals suffering from Clostridium difficile infections. These healthy fecal bacteria then can grow in the patient and recolonize the patient's large intestine, keeping the Clostridium difficile growth at bay. These treatments have proved highly effective and are gaining in popularity around the world. Next, we'll move on to airborne bacterial infections. When we take a look at the human respiratory system, there are two major classes or regions of the respiratory system. There is the upper respiratory system, which includes the nasal and oral cavity, as well as the pharynx and larynx. And then there's the lower respiratory system, which is basically anything below the trachea and includes the bronchi, bronchioles, and alveoli. The alveoli are what make up most of the lung tissue. Air is an exceedingly effective transmitter of infectious disease because small particles of microbes can travel and reside in the air for long periods of time. This is what we've seen in cases such as tuberculosis and measles, where aspirated tiny droplets or aerosolized cough fluids can float in the air for long periods of time and inhaled by individuals that enter rooms hours later. We're going to first focus on upper respiratory tract infections and then go to lower respiratory tract infections. The first of these upper respiratory tract infections your book discusses is whooping cough, otherwise known as pertussis. The reason why it's called pertussis is because it's transmitted by a bacterium known as Bordetella pertussis. Pertussis can cause infections in adults, but is of primary concern in infants and young children. When this pathogen invades the upper respiratory tract, it can end up growing and forming large clumps of very thick mucus as a result of exotoxins that the bacterium forms. This very thick mucus is not easily cleared from air passages and can build up causing a very obvious spasm of violent coughing that is characteristic of this particular disease. These coughing fits can last for up to 10 weeks or more, and the mucus can become so thick that it can end up blocking airways, leading to death in these young individuals. In the early 1900s, before the whooping cough vaccine, whooping cough was rampant, and many hundreds of thousands of people would be diagnosed with whooping cough, with more than 8,000 deaths every year. However, with the advent of the pertussis vaccine, which is a component of the DTaP or Tdap vaccines, the cases of whooping cough dramatically declined. Today, pertussis is considered a re-emerging infectious disease. That is because there are some individuals that are resistant to vaccinating their children, and as a result of this, whooping cough is once again on the rise. Almost 18,000 cases occurred in 2016, and some of these cases led to deaths. The 7 deaths that occurred were all in children younger than 1 year of age that did not have the ability to resist the infection on their own with their own immune system. These 7 deaths arguably were completely avoidable if parents had vaccinated their children. As a result of some parents being reticent to vaccinate their children, the CDC is now increasing its recommendations for pertussis vaccines and recommending that not only children receive the DTaP vaccine, but that pregnant women also receive it, with the hopes that the vaccine can be protective not only to the mother before she gives birth, but also to her unborn child. There are a list of different infectious diseases spread by the air in your book, and Table 12.8 is a nice summary. We just talked about pertussis or whooping cough. Now we'll start talking about streptococcal infections. Streptococcal infections are also infections of the upper respiratory tract, and these can lead to things like strep throat. One of the most significant of these streptococcal bacteria is Streptococcus pyogenes. This is the microbe that is known for causing strep throat. It's generally mild, but can lead to life-threatening conditions in some patients. And as a result, individuals diagnosed with strep throat are fairly frequently prescribed antibiotics to keep it from progressing to the more deadly version of this disease. In some cases of strep throat, the disease can progress to scarlet fever, which is characterized by a strawberry rash on the tongue, pictured like what you see here. Streptococcus pyogenes is not just acquired through the respiratory tract, however. Some can be invasive and enter the body systems in other ways. This includes toxic shock syndrome, in which case the microbe can enter mucous membranes, causing multi-organ failure and death, and necrotizing fasciitis, a disease that's commonly called flesh-eating disease. Flesh-eating disease can be acquired through any open wound in the body, and when Streptococcus pyogenes enters the bloodstream this way, it can cause necrosis or death of the tissues in that area. This is another very deadly version of this disease. Necrotizing fasciitis and toxic shock syndrome are both very rare, but make headline news in frequent cases when they happen. Treatments for necrotizing fasciitis include intravenous administration of antibiotics, skin graft surgeries, amputations, and hyperbaric oxygen therapy. Hyperbaric oxygen therapy is a way of adding much more oxygen to the body's systems to help the body fight off the infectious disease. The last type of upper respiratory tract infections that your book mentions is bacterial meningitis. There are lots of different sources of meningitis. Meningitis is essentially an inflammation of the meninges, which are the membranes that cover the spinal cord and the brain. This inflammation can cause swelling and problems with brain and neural function. Meningitis is a fatal disease. As I mentioned, meningitis can be caused not just by bacteria, but also viruses. However, since this chapter covers just bacteria, that's all we'll be covering in this section. Bacterial meningitis can be acquired through the air, particularly from the two most common species of bacterial meningitis are Neisseria meningitidis and Haemophilus influenzae. Haemophilus influenzae sounds like it causes the flu or influenza, but the flu is actually caused by a virus. Haemophilus influenzae, or Hib, is a bacterial cell that can cause bacterial meningitis. This microbe can be transmitted from person to person through coughing and sneezing, and is found in healthy asymptomatic carriers as well as diseased carriers. Because it's transmitted from person to person, it is not uncommon for this disease to be transmitted in daycare centers and schools. It is particularly damaging in younger children. However, the incidence of this particular disease has been decreasing since the advent of the vaccine for Hib in the early 1990s. Unlike Hib, that affects very young individuals, younger than 5, Neisseria meningitidis affects primarily those who are young and teenage years. These individuals can acquire Neisseria meningitidis from healthy asymptomatic people as well as sick individuals. Again, the symptoms of this disease are just like meningitis, which include a headache, nausea, vomiting, confusion, and also fever. There is a vaccine for this form of meningitis as well, usually given to students prior to leaving for college. College dorms are particularly susceptible to meningococcal diseases. These Neisseria meningitidis bacteria can also exit the respiratory system and enter the bloodstream, there leading to meningococcal septicemia, which can cause infections in the bloodstream, again leading to fever, fatigue, vomiting, rapid breathing, diarrhea, and eventually, possibly, death. The effects of meningitis can be short-lived if treated with antibiotics, but some of the symptoms can last a lifetime, even after treatment. The next section of your book talks about lower respiratory tract infections. This consists of the trachea, bronchial tubes, and lungs, in particular the alveoli. We will talk about these in the next section.